Hello, this is Dr. Zaina Carver. I teach human anatomy and physiology at Columbia Basin College. And this presentation is to tell you about a project that I'm working on this summer called Breaking the Thyroid Code.
Thyroid disorders are incredibly common. The American Thyroid Association estimates that about 20 million Americans are affected, yet as many as 60% are unaware that they have a thyroid condition. Thyroid dysfunction is often misdiagnosed or undertreated. Women are more commonly affected, yet their symptoms are easily confused with other conditions. Many people suffer from thyroid-related symptoms. Fatigue and weight gain are the most common symptoms, but thyroid hormones affect every system in the body, so they can cause a wide variety of nonspecific symptoms.
I have a personal history with this issue. I have a history of thyroid cancer, papillary carcinoma in 2005. And I have had my thyroid removed, a thyroidectomy. I've had the radioactive iodine ablation. And since then, I've been on thyroid hormone replacement for over 13 years now. But none of that compares to what I went through a few years ago when my endocrinologist took me off of TSH suppression. TSH suppression is where thyroid medication is dosed just a little bit high. When this happened, just a few weeks after the dose changes, I felt tired and run down, but it was okay the first few weeks. It progressed rapidly though. Not long after that, I felt completely exhausted. I was freezing. I wore a ton of layers. But what was scary is that I would fall asleep just for a few seconds at a time, and then I would catch myself and try to do something different to stay awake. At the same time, I had what is referred to as brain fog, and this is where you can't think clearly. It's difficult to remember some of your facts or details. Sometimes you can't find the right word. Problem solving and memory, as well as concentration, that was affected. So my performance suffered during this time. I was not eating well. I drank pot after pot of caffeine, of coffee. I ate a lot of sugar just to try to get my energy back, but this backfired terribly because my blood sugar would drop about an hour or two after any meal or snack, and then I would be nervous, shaking, dizzy, about ready to pass out, and miserable. Also, during this time, I missed a lot of work because I was sick. I caught every respiratory infection going around, and I just couldn't fight it off. I was sick for weeks where normally I would be fine after a few days. So I missed a lot of work. I fell behind on projects. I became so weak and dizzy, I could barely even walk straight. And what was really scary is that I had to commute an hour and a half to work, and I was terrified about falling asleep driving home. I would try to get some activity, just a little walking before driving home. I would turn my radio up full blast on static, turn the air conditioner up full blast, take some stretching breaks, but even that wasn't enough. I was so tired driving home, and I had to leave early on many occasions. So I left a few hours early. We're talking driving home in the afternoon, and there are days where I had to take Sudafed just to stay awake driving home, even though that didn't work for very long either. Also, during this time, I want to talk about the secrecy, the misperception surrounding thyroid disorders. When a person has a thyroid condition, it's not clear to the rest of the world. It may not even be clear to them. To everyone else, it just looks like you're lazy and unmotivated. And that couldn't be further from the truth. People who struggle with their thyroid are trying so hard to get their life back and to help their productivity and their relationships. And yes, relationships suffer during this period of time too. My husband and my sons were as understanding as they could possibly be. But I ask you, when someone is so exhausted that all they want to do is sleep and they have no interest in anything, including their spouse, how long before their significant other, before they start to feel unloved and unwanted? How long before children feel neglected? You be the judge. So I would like for you to join me in this inner circle so you can understand the thyroid, and more importantly, what it takes to keep your thyroid healthy and for your cells to be able to use that thyroid hormone rather than being in the dark and suffering in secrecy and not understanding why your life is affected and why your health is affected. If you could picture a perfect day, waking up full of energy, able to tackle the world, able to communicate well with everyone, and just get your life back, that is what your life could be with the right information.
Here's the book project that I'm working on this summer, which is supported by the Exceptional Faculty Award from Columbia Basin College. I am so thankful for them and for this award. And I'm so thankful to my graphic designer, Cindy Ray Getzmeyer. She is phenomenal. She did this beautiful book cover for me, and this is her photograph. The plan is to have the book finished, ready for pre-release in August of 2018. And it's going to be written in sections so that a person can read it quickly depending on what they want to know. If they want all the details starting from the introduction, they can read that way. If they want to skip ahead to find out what's useful for them, they can read that way as well. And if someone is just curious about a few topics, there is a scientific section where I explore a couple details or topics in more detail, and everything's referenced. So they can skip ahead to those sections if they would like also. The benefits of this book project include increasing thyroid awareness and increasing the understanding of thyroid function, thyroid tests, as well as thyroid treatments. Also, knowing what dietary changes are helpful, what supplements or types of exercise can be very helpful. Also, how to be more productive when energy levels are low, and how to lower your stress and sleep better, as well as how to avoid environmental triggers. Puppies. What do puppies have to do with the thyroid? I know you're thinking that. I want to go back up here and just talk about lower your stress and sleep better. Anything that helps to lower your stress is going to help your thyroid. The body doesn't function, no organ system functions in isolation. And stress can certainly be a factor that disrupts thyroid function. So what is this thyroid gland, and what's the big deal about it? It is a small butterfly-shaped gland located in the neck. As I was creating this image, my son looked at it and said, "Mom, no one's going to believe you have a thyroid." And I just chuckled to myself and thought, nope, I really don't have a thyroid. That's okay, just showing what it would look like if I did. But I do have a better image here. Let's take a look. Here we have the thyroid gland. You can see it's butterfly shape. That's the reason why it's a symbol for the thyroid. And you can see that it lies anterior or in front of the trachea. And the trachea lies in front of the esophagus. And this is the reason why when someone has a goiter or nodules or swelling within their thyroid, that can cause their neck to feel very tight. And it can even cause difficulty with swallowing. I also want to mention that the thyroid makes several types of hormones. And it doesn't just make thyroid hormones, it also produces hormones important to manage calcium levels in the blood. And one example of this would be parathyroid hormone, which is produced by the parathyroid glands. Now they're separate from the thyroid. They're hard to see without doing this. Those three bean-shaped organs are the parathyroid glands, and they help to increase calcium levels in the blood, which is having a set level of calcium is very important for the nervous system and the muscular system. Next, I want to talk about thyroid hormones. The thyroid gland produces two major thyroid hormones, T4, thyroxine, and T3, triiodothyronine. They're named for the number of iodine atoms attached to the tyrosine backbone. And what these thyroid hormones do is they act to increase metabolism in tissues. And when I say tissues, I really mean in cells, but I use the two interchangeably just so that you know that's where it acts. What metabolism is the rate of chemical change, of converting oxygen and nutrients to energy and heat. Now, when thyroid hormones are low, this condition is called hypothyroidism. And basically, metabolism slows down. So the symptoms would be low energy, feeling cold, sometimes just cold hands and feet, but it affects every system. It can affect the gut, it can affect absorption, it can affect the microbiome, cholesterol levels, the heart rate, respiratory rate, blood pressure, the nervous system. It can affect the ability to concentrate and remember. It can even cause depression when thyroid hormone is low. If thyroid hormone is high, this condition is called hyperthyroidism. And in this case, the nervous system and the heart are overstimulated as well as other organs. This can cause nervousness, anxiety, sweating, chest tightness, and heart palpitations. The most common causes of thyroid dysfunction are autoimmune conditions such as Hashimoto's thyroiditis and Graves' disease. With Hashis, there are antibodies, and instead of seeking out something that's foreign, they attack the body's own thyroid gland. But with Graves' disease, they overstimulate the thyroid and eventually cause it to burn out. Here's the feedback loop. For anyone who has been tested for thyroid disorders, you may see the words or the mnemonic, the initials actually, TSH, and that stands for thyroid stimulating hormone. But what is this? Well, it's produced by a structure called the pituitary gland, and it does exactly what it says. It acts to stimulate the thyroid. So when thyroid hormone levels are low, the pituitary increases thyroid stimulating hormone to cause the thyroid to produce more thyroid hormones to increase metabolism. But this is called a negative feedback pathway because when their levels increase, this shuts off the pituitary. And what that means is that in some cases you can measure a TSH and that can indicate thyroid levels. If TSH is high, that means it's shouting at the thyroid to produce more. That means usually that thyroid hormone levels are low. But if TSH is low, then thyroid hormones are usually high. But that's not the full picture. The full picture includes the hypothalamus, which is a neural structure, and it directs the autonomic nervous system, the part that we don't have to think about because it's involuntary. But the interesting part here is that it uses a lot of different information. It integrates all these signals coming from hormones and chemicals in the blood and the brain itself, and it can direct the system by producing thyrotropin releasing hormone, which acts to increase thyroid stimulating hormone. This diagram shows how these pathways interact. No tissue or cell functions in isolation, and these signals communicate to one another, but also through these pathways. So adipose tissue, shown in the bottom right, for instance, produces a hormone called leptin. This is fat tissue, and leptin communicates to the hypothalamus about the body's set point for weight. The liver, shown on the left, helps to convert or activate thyroid hormone so tissues can use it. So in a nutshell, this feedback pathway can be disrupted by external factors, such as stress or illness, but also by different types of hormone resistance, such as insulin resistance and leptin resistance. I also need to talk about how cells use thyroid hormone. Thyroid hormone has to be converted from the storage form T4 into the active form T3 by removing an iodine atom. And processes or abnormalities such as inflammation or hormone resistance may affect the conversion of these hormones. I want to show you that there are enzyme systems. An enzyme just converts one molecule to another. And with this example here, these are called deiodinases. There are 3 different types. D1 and D2 help to activate T4 by converting it to T3, which the tissues can use to increase metabolism. But a third enzyme, D3, inactivates T4 by converting it to reverse T3, and cells can't use it. This would act to slow down metabolism. And there are times when that's protective. For instance, during a famine where metabolism has to slow down. This can also happen with extreme low-calorie dieting. But it can be a problem when the system is disrupted. Severe or prolonged stress, nutritional deficiencies, famine can slow this pathway down by increasing D3 that inactivates thyroid hormone. Now the problem here isn't so much this dysregulation. It has to do with how thyroid status is tested for. And that if you just look at TSH and just a T4 possibly, there are cases called thyroid hormone resistance where thyroid levels are normal in blood, but they're not normal in tissue. The problem is that there's no one single agreed upon test to show this. So no one can say that this is a rare problem. And I want to give you one example. I was so proud when my son brought home the Student of the Month award, and he had this beautiful little sticker, and I stuck it in my car. And about a year and a half maybe, I noticed that some of the letters were missing. And when I looked closely at it, it then said Stud of the Month. And this is exactly what's going on in this case. There is something missing. The doctor who is just ordering a TSH, if the patient's symptoms aren't going along with what that lab result says, is missing a piece of the puzzle. And when I looked at thyroid books and I searched Amazon, for instance, there were 4,000 matches for thyroid book. And on Google, there were over 10 million matches. This tells me that there are many people out there who are desperate for answers because they're not getting the right help or their lab results aren't reflecting the way that they truly feel. Which is why I started thyroidcode.org. This is an informational site to help people understand these issues, to communicate with their doctor, where to go for good nutritional information, for instance. It's blue filter because blue is the traditional thyroid code. The brand in the upper left was created by Cindy Ray Gatzmeyer. And I want to leave you with some final words, and that is to visit thyroidcode.org to find out more information. But more importantly, this is an educational site meant to help people who are struggling. It can do no good if people aren't able to find this information. So please share information to whoever may need it so that they can get the right help. I want to offer a sincere and heartfelt thank you to Columbia Basin College. They have graciously awarded me with an exceptional faculty award, and that has made this project possible. I want to thank my graphic designer, Cindy Ray Gatzmeyer, and I especially want to thank you for listening. Have a wonderful day.